So I'm especially pleased to be joined by my friends and colleagues here in today's program, Marsha Salzwedel, who works with me at the National Children's Center, Dennis Murphy from Penn State. We worked together for many, many years. Marilyn Adams, who is joining us virtually, but sort of not exactly, but she has prepared her remarks for today. And then Jana Davidson, who's representing her program, which the founder, Susan Reynolds, had worked with me in the very early years. And I also want to thank AgriSafe for hosting this webinar today, letting us make it happen through your really cool system that you have. So with that, our presentation today is going to be a little bit of the history of the child egg safety movement, some of the efforts of our Children's Center over the past 25 years, a little peek at the future, and then we'll be hearing from our guests, and then wrap it up with some questions and an open discussion and any other comments that you have. So we want it to be casual, open discussion, and feel free to throw questions into the chat box as we go along, and we'll address those at the end of the session. Okay, so with that, I think we'll go ahead and start the slides, and I'm going to ask Marsha just to show the first slide here.
In the fall of 1986, Marilyn Adams lived every parent's worst nightmare when she lost her son Keith in a farm accident. While helping his father with the harvest, the 11-year-old climbed on top of a gravity flow wagon, was sucked under the corn, and suffocated.
A lot of times we give them more than they can handle. That's what we did with Keith. We gave him an adult job, expected him to react like an adult. And I guess I would be the first one to tell you that giving a child's life to farming is not acceptable.
Okay, and you'll hear more from Marilyn in a bit. So the background to this, and Marilyn and I met each other back about 1987, and that's when Cheryl Tevis and her colleague published this article in Successful Farming magazine. The headline, "We Killed Too Many Farm Kids," really sent shockwaves to the farming community and made people ask the question, what is going on? How common is this as a problem? And we got some rough estimates back from about that time from Dr. Fred Rivara, who suggested that 300 children died from farm fatalities each year. And then from Ted Miller at the Pacific Research Institute, he suggested through an analysis that about 300,000 serious, there were 300,000 serious child farm injuries each year. So those are really big numbers. It really got the attention of people, and we decided we needed to look at this more seriously. Because up until that time, most of the work in farm safety had addressed adults and traditional farmers. Next slide. So what did we need back at that time? We had really no data, no good data, except for these rough estimates that I just shared with you. And there were no youth work standards. There were child labor and ag regulations, but they were very broad. And of course, the family farm exemptions meant that it wasn't comparable to other industries. We also had these agricultural norms regarding what children should do and can do, and some of that spilled over in terms of farming, and the expectation that farming as a hazardous industry just meant that there were going to be unavoidable injuries and deaths. And most important to this initiative was there was no responsible federal or state agency. It got children and farming kind of fell through the cracks because it wasn't like child welfare or child protection in general settings, and it wasn't like an occupational situation. So nobody really wanted to take charge of this. And looking around, there were very few safety resources that were specific to children, whether working or non-working. And then we have what's known as the farm kid paradox, where it's adults want to benefit, they want to balance. What are the benefits? What are the risks of kids being on farms? Because we know that there's many benefits out there, and we have to kind of weigh the balance of risk versus benefit. So I'm going to ask you, in what year was the first Childhood Agricultural Safety Symposium held to help define the problem? And we're going to ask you to go ahead into, do they do this in the chat box? Okay. Go ahead and answer that question and we'll help you out with it. Was it 1987, 1992, 1996, or 2002? Okay, Stacy? Something kind of froze up on mine. Okay, you can see the results here, and the correct answer is 1992. The first time there was a conference or symposium to look at this topic specifically, 1992 in Marshville, Wisconsin, and it was funded primarily by the Kellogg Foundation. Next slide. So we'll just talk a little bit about this national initiative in 1992 with the symposium, and we had the director of NIOSH at that time, Dr. Don Millar, came and we brought in 120 people to look at the problem from different perspectives. And I know that some of you on the call today were actually part of that first event where we developed a picture of the scope of the problem. From there, a group of people named the National Committee to Prevent Childhood Injuries created a plan to garner national attention. It came out with the 1996 National Action Plan for Childhood Agricultural Injury Prevention. We took that plan to many different organizations, farm organizations, medical organizations, educational groups, journalists, and asked them to sign on to that plan in principle, because the plan did have things like surveillance, national leadership, education, public policy, and other interventions as recommendations. And with the signing of those organizations, the document became pretty powerful. And we presented that plan then to NIOSH, asking them, would you be the lead agency in charge of this issue? Dr. Linda Rosenstock at the time met with us, and she looked at us and like, really? I don't know, maybe. And then her response was, if you can get some money, we'll take it on. So a group of us then went to our policymakers, and Senator Tom Harkin from Iowa endorsed the plan into the congressional record. And then Congressman Dave Obey actually arranged for the appropriation of funding for that, so that NIOSH then had separate allocation of funds just for this initiative. So really by 1996, then late in that year, multiple activities were launched by NIOSH. They began their child egg injury surveillance in collaboration with the Bureau of Labor Statistics, National Egg Statistics Service, et cetera. And they launched an extramural research program. They then decided to have a national center of excellence, like this outside center, coordinating center. And they developed an advisory group of representatives from different federal agencies to keep this on track. So NIOSH really took this seriously and did an excellent job of coordinating things and really putting some money out there for things to happen. It was then the following year, in 1997, that the National Children's Center here in Marshville was formally established through a competitive grant. We were fortunate to secure that and have had that funding renewed every 5 years since 1997. So back at that time, we said we really didn't know much. We didn't have good guidelines. We didn't have good data. So our first effort was to develop voluntary guidelines for what type of work should children be doing in agriculture. Tell us about how to have safe play areas on farms, which in itself was a bit controversial. Some folks said just you shouldn't even have play areas out there. And for each of these types of things, we tried to gain consensus of people like the key stakeholders, whether they're farm safety specialists, farm organizations, a lot of farm parents, and then groups like the American Academy of Pediatrics to really set those high standards, but make them reasonable and fit. We also develop model policies for employers who are hiring young workers and develop recommendations for off-farm childcare. At the same time, NIOSH was funding a lot of independent research studies for such as gathering evidence and testing interventions. Many of those were testing at that time the North American guidelines, which were our initial work guidelines. And other research was looking at what were the root causes or the sort of the etiology of what gets kids into these situations, whether working or non-working, and what happens, what precipitates the injury events. So I'm going to ask the question, what were the three founding organizations then of the Childhood Agricultural Safety Network, which is the loose-knit coalition of individuals and organizations? And we have a question here. You have 4 options. Go ahead and answer that question. Okay. Okay, and we have our answers here. The correct answer is the third one. 43% of you have that right. Marilyn Adams with Farm Safety for Just Kids, Susan Reynolds from the Progressive Ag Foundation, and myself. And we called ourselves our little team of people who started to meet frequently and had that organization, the coalition, grow primarily through meetings at the National Institute for Farm Safety. So we'll do the next slide, and I think I'm going to have Marsha take over here.
Well, thanks, Barb. So as Barb mentioned, the founding organizations for the Childhood Agricultural Safety Network started with the 3, and that started actually in the year of 1999. And since that time, we have grown that organization, and we've recently switched over to an online community. And I just checked yesterday afternoon, and our online community is now at 163 participants. So those represent over 100 different organizations. So this network has grown from the 3 founding organizations to well over 100 different organizations that are very interested in child egg safety and health. Now, this network represents a wide variety of people in the agricultural industries. There is everything from academics, there's safety and health professionals, there's extension personnel, there's also farmers and farm parents, there's egg industry manufacturers like John Deere, and a whole wide variety of different types of organizations. But the one thing that they all have in common is they're all interested in child egg safety and health, and they all want to work towards making improvements in that arena. So over the years, we've also done a lot of different campaigns. Barb mentioned some of the information and some of the campaigns and guidelines that we've done. The Child Egg Safety Network actually banded together and have created several different campaigns. One of them, the Keep Kids Off of Tractors campaign, probably the most popular, even to this day, still very much used and still very much controversial, but very effective campaign. We also have a media guidelines campaign, and we have just recently redone the ATV and turned it into an ATV and UTV campaign, which we'll be launching next month. Our Cultivate Safety website is a website that we've just recently developed within the last several years, and that website is specifically geared towards farm parents, farm owners, farm operators, media. It's not a scientific website, but it contains over 200 resources. Everything is free to use, and it is just packed with safety information. So just a lot of really good work being done over the last several years, not just by the National Children's Center, but in conjunction with a lot of other organizations as well. So a couple of questions that we are kind of curious. We talked earlier about the number of youth that die in agricultural related incidents and what it was back in the beginning. So what do you think that number is today? Is it 33, 100, 175, or 300? Okay, and interesting, you've got it correct. It is 100, just slightly over 100 actually. And about well over a third of you got it. So yes, and the 300 mark was what it was back in the beginning. So we'll talk more about that in a bit. Conversely, when we start talking about non-fatal injuries, on average, how many youth do you think are injured in agricultural incidents each day? 15, 33, 50, or 100? Now remember, this is daily, and these are serious injuries. So if this child was an adult, they would be off work from this type of an injury for at least a half a day or a day. So how many kids are seriously injured every single day in the agricultural environment? And a lot of you got it. It's 33, that's correct. So, all right. And so just to kind of go forward a little bit, those are 2 out of our top 5 injury statistics. A child does die in an agricultural related incident about every 3 days. Now, keep in mind that these children that are dying, that are injured or are dying or are injured are not necessarily working. It's important to keep in mind that while agriculture is one of our most dangerous work sites, it's also the only work site in the US where children of any age can be present. And when we talk about younger children, we also know that about 60% of the ag-related injuries happen to children who are not working. So a lot of those are the extra riders on equipment and children that are being taken into the work site. We also know that when it comes to fatalities, that the number of ag-related youth worker fatalities is higher than all other industries combined. So those are the top statistics that we're working with nowadays. So the question now is, what do you think the 3 most common causes of child ag fatalities or child ag-related deaths are? Motor vehicles, drowning, and machinery. That's absolutely right. Animals are one of the most common causes, actually, of injuries, but they're not of fatalities. And as we move on, we can see that the top 3 causes of fatalities, as we said, are machinery, motor vehicles, and drowning, and non-fatal injuries are falls, animals, and machinery and vehicles. But it's important to keep in mind that we're not talking about just injuries and fatalities. That's not the only issues that we have to deal with when it comes to children on farms and ranches. And this has become very evident over the last couple of years with the advent of the COVID pandemic. But even prior to that, there were other zoonotic diseases that we also had to deal with. But there's also things such as hearing issues and vibration, dust and molds, and other types of hazards that you can see on the farms as well. So while we do talk a lot about injury prevention, it's important to remember that there are also illness and health issues out there affecting children and youth on farms as well. So what do you think is the best strategy for preventing injuries and fatalities to young children on farms and ranches? And keeping young children out of the farm ranch work site absolutely is the best strategy. Great. When it comes to keeping children and youth safe. The safety strategies vary a little bit depending on whether the children are younger and or not working, or whether they're actually working. For young non-working children, keeping kids away from tractors and keeping them out of the work site are the two best strategies. And it's not always a popular strategy, especially as these types of behaviors tend to go against the traditions. For those of us that grew up on farms, we probably did all of that when we were growing up and just didn't realize at that time just how dangerous those practices were. When we start talking about youth that are working on farms, it becomes more important that we ensure that the work that they're doing is age, or more importantly, ability appropriate. When we talked about more youth die working in agriculture than all other industries combined each year, the majority of those injuries and fatalities are due to youth doing work that doesn't match their physical and cognitive or mental abilities. And so if we can match up those abilities and make sure that youth can actually safely perform the job, we can eliminate a lot of those injuries and fatalities. It's also important that we ensure the environment is as safe as possible, so address your hazards and provide personal protective equipment, and also make sure that all youth are trained adequately for the job and are proficient at the job before you let them do the job on their own. And to be perfectly honest with you, this is all really good strategies regardless of the age of the worker. And Barb, would you like to take back over again, please?
Sure. Thank you, Marsha. I want to just share some of the impacts of what's been going on over the past 25 years and 30 years, especially since national attention was put into this. The Child Egg Safety Network, Marsha just reported it's up to more than 160 actual organizations now involved in this. We know that from 2008 to 2014, there was a 60% decline in non-fatal injuries, although we don't have any trends for the last 6 years since NIOSH stopped doing their national injury surveillance. We also were excited that several years ago, the CDC issued their top 10 public health successes in occupational safety, and the Childhood Agricultural Safety Initiative was listed among one of their top successes. USDA and many non-government organizations have been involved in supporting programs in addition to NIOSH, so that there are more funds available to conduct research and more funds available to do programming. And the original North American Guidelines for Children's Agricultural Tasks, or NACAT, many studies were funded to look at their efficacy, their dissemination, their validity. And it was demonstrated that where the guidelines applied and were used, that farm injuries to children were reduced by half. Next slide. Other impacts, many of you are familiar with the Ag Injury News, the database of publicly available farm injury events. This is a growing collection of news articles that are available to any of you to sign on and have access to them. And it's really become the go-to source for finding out what's happening with children and farm injuries. And you can search it by year, by age, by agent of injury, and really get a good picture of what's going on. But keep in mind, it's only the events that find their way to the news. Another impact has been the action plans. So I mentioned the initial 1996 National Action Plan, which launched the funding for NIOSH and launched kind of national priorities for action. That has been updated 3 times since then. The last one was in 2012, which is the blueprint. We refer to it as a blueprint. And over time, the recommendations have really evolved from basic epidemiology and basic surveillance to testing interventions, to more outreach, and then knowledge mobilization of getting information out and used by the farming community in terms of what actually works versus what might not. And then just a heads up that our Children's Center is in the process now of planning to update the action plan with a release in 2025. So we have had a lot of accomplishments, impacts, and reduction in non-fatal injuries, but there's still some concerns out there that we have limited data. We're not able to track trends anymore because there's no national repository of data. We also know it's difficult in reaching certain groups, certain subpopulations or certain regions of the country. And that's always a challenge, is like, how do we provide resources or offer guidance if it's wanted? A concern that we have now is a massive increase in the use of ATVs, UTVs for work and recreation, and also the increased use of skid steers because they're smaller, they're easier for young people to operate. And in the farming communities, they're used for multiple purposes. So as Marsha mentioned, the Child Egg Safety Network has launched a recent campaign, updated information about ATV and UTV safety. So you could be sure to check out those resources. Other concerns are things like the outdated child labor laws and limited accountability of adults when there's reckless endangerment of children, things like taking kids for joy rides on tractors, that type of thing. So some of those things are going to be really difficult to address in the future. We also know the agricultural economy is fluctuating, some really rough years when people can't afford any safety equipment. And if it's not safe for the adults, it's not going to be safe for the kids either. We also have labor shortages, and then all of these things lead to times that children are used to fill in the gaps for labor in the farms. And then probably the biggest one that we're talking about these days is limited, affordable, and accessible childcare. So we hope that with some of the recent administrative influx of funding for the infrastructure, the new funds that are going to the rural communities to build up like broadband internet and transportation, we're hoping that that will help strengthen rural communities. And a future kind of social package that has been proposed would have notable funding for childcare. But some of these, there could be a short-term benefit or improvement, but others would take a major buy-in from either federal agencies or farming organizations to deal with things such as regulations. Okay, I think next slide.
I'm going to actually circle back to these invitations that I have here at the end of the program. So
Okay.
in the meantime, does anybody have any questions?
I see that Melissa put into the chat box where to find the ATV safety campaign information.
And thank you for that, Melissa.
And Amy commented about the child egg injury fact sheet, which was recently updated. So you have a 2022 version of that. And
Yep,
I think that's posted, isn't it?
It's not yet. It's coming out within the next week. We're just cleaning up a couple of cosmetic issues, and it should be posted within the week.
Okay. All right. Thanks, Marsha.
All right. Any other questions? All right. Barb, you want to introduce Dennis?
Sure. So next we're going to have a few words from my friend and colleague, Dennis Murphy, who's been dealing with farm safety as long as anybody else on this webinar. Right, Dennis?
Probably so. Probably so. So, yeah, hello, everybody. Nice to see you, those that I can actually see or see me. But yeah, Marshfield asked if I would just contribute a little bit, tell some stories, keep it light, keep it short. And so I can certainly do that. And I was, and I have been involved from the beginning, but even before that with things. And in fact, the story I want to tell is about how Barb and I really connected. Because I think, we met at the NIFS, I think it was a late fall meeting it's ISASH now, but it was National Institute for Farm Safety. It was when we had 2 meetings a year. This was in Chicago because we met with in association with the National Safety Council, Safety Congress. I had, and she was looking at things in the 80s, and I had already written a couple of publications, and one in particular was called Safety in the Developing Child. And I haven't looked at it since the 80s, but I did look at it for get ready for this. And I mean, I was talking about things about concept development and learning and imitation and motor development and how all those things related to safety and health, not from an ag perspective per se, but just for child development in general, and connect it to cultural values and just all kinds of different things. And so somebody writing something like that, in extension back in that day, especially, and out of an engineering department when there were most of the extension specialists were engineers, and I wasn't, never have been, don't claim to be. So I think she thought maybe he actually knows something. I've been trying to convince her that I don't know anything ever since then, but they keep reeling me in. But anyway, I think what really bounded us is that I took her to a horse race. She had, I know I'd never been to such things, but my dad actually had harness horses in Illinois. I grew up in Illinois. And so we had harness horses, and he actually had a horse racing at one of the Chicago racetracks back in the late 80s, I think, mid to late 80s. And so we went. I know our horse won. So we bet and stuff. But anyway, it was just, I think it was a little bit different, and we just have always connected. I keep trying to get away from them, but they don't let me. I've been involved in all the things that they've done ever since they've had the committee, and helping back in '92, I think, in '96 as well as those committees. So, but it's been a real pleasure. I think it's one of the success stories that we do have in ag safety and health is the child center, and just all the efforts that everybody keeps making for that. So with that, I'll go on, but it was the horse races that I think really solidified the connection between Barb and myself.
Thanks, Dennis. I think everybody needed to know that. We should have had that as a trivia question, right? And I see Brad Ryan has joined us. He probably was there too, if I'm not mistaken. Okay. So next, we're going to have some words from Marilyn Adams. And Marsha, I'll hand it back to you.
Okay. So let me share my screen here. So Marilyn was not able to be with us, unfortunately. But what she did do was she sent us some information and some video clips. And so I'm going to share those with you. So I apologize for you having to listen to me talk again. But I do want to share Marilyn's thoughts and her videos with you. So Marilyn said that as she was thinking back about this, time has a way of moving so quickly, and then all of a sudden you're looking upon those passing years. It seems like yesterday that we started the children's farm safety movement. I can't help but wonder where all the years went. I have very special memories of how it was back then. And she goes on to say that when she founded the Farm Safety for Just Kids in 1987, she could have never imagined that it would involve this kind of work. And as you saw in the previous video, it was all due to the loss of her son.
I guess I would be the first one to tell you that giving a child's life to farming is not acceptable.
Adams was determined not to let her son's death be just another farm industry statistic.
Play safe to stay safe. And
1 year later, Adams formed Farm Safety for Just Kids.
When I can actually spend time with these kids, it's really a highlight for me, because I can, it pumps my adrenaline, so I can see that they can learn and be a part of all of that, and they get so excited, and they even connect with Keith like that.
All right. Sorry, I lost my mouse there for a minute. She goes on to say that there are so many wonderful memories from working with Barb Lee and her staff. She didn't know where to even begin when we asked her about this. She said the 1991 Surgeon General's Conference on Agricultural Safety and Health, which was held in Des Moines, Iowa, she feels was the turning point. In 1992, the Childhood Agricultural Injury Prevention Symposium was a follow-up conference in Marshfield. And you heard Barb and Dennis speaking about that earlier. We all work so hard, she said, to have a better understanding of the key issues involving the media, pediatricians, engineers, educators, farm parents, plus individuals from nonprofit organizations, corporations, and government officials, assured that they did their best to cover most of the topics. She said she's proud to have been one of the members that worked with all of us, to develop the very first National Action Plan that was released in 1996. She remembers it was endorsed by more than 80 professional organizations, as Barb mentioned earlier, and then later was endorsed by the US Congress and funded for implementation. And of course, as Barb said, NIOSH was chosen to roll out the plan. And the funding, of course, as Barb mentioned, culminated in the launching of the Children's Center in 1997. Farm Safety for Just Kids was one of the 3 founding organizations of CASN in 1999, and which, as we mentioned, has grown from the original 3 members to well over 100 organizations today. In 2016, Farm Safety for Just Kids transitioned their educational materials, research, and outreach efforts to the Progressive Ag Foundation, and we'll hear from Jana from Progressive Ag in just a couple minutes. Progressive Ag Foundation has a similar mission to what Farm Safety for Just Kids did, and Marilyn likened it to sending your child off to college. Marilyn says, I remember how well the different organizations worked with corporations, government agencies, and elected officials to fund projects, research, and implementation efforts. She said that they were all young and vibrant as they pursued childhood injury prevention efforts.
You know, when I look at the statistics, compared to 300 children dying on farms back when I started the organization, and now a little over 100. All of us that are in the children's farm safety movement should be proud that those numbers have changed, but that's an average of 2 children a week. Looking at the whole picture, we've got a lot of work to do.
Oops, sorry. And she finishes up by saying that even though some of us, meaning herself, have now entered into a new season of their lives, she's confident the children's safety movement will get bigger and better and will always continue. And a special thanks out to Marilyn, if anybody sees her, for sharing her memories and her time with us.
Right. Thank you, Marilyn, wherever you are today. We appreciate your comments and your reflections. Much appreciated. Next, we want to hear from Jana, representing Progressive Ag Safety. Used to be Ag Safety Days, and it's your program now. And you're in some ways carrying on the great work started by Susan Reynolds.
Exactly. And of course, I have to follow all those amazing presentations today. So I'm going to try to end things too on a positive note, because it is very inspirational to hear all of these stories of these folks that really led the way for what is happening right now with farm safety and health, especially for our youth. So I want to focus today. My name is Jana Davidson. I am the program manager here at the Progressive Agriculture Foundation and the Progressive Agriculture Safety Day program. But I want to focus today on the relationships that have been formed over the years in my 8 years here with the foundation, as well as the relationships that formed before I started here, because that really has been so instrumental in the job we get to do. And also, I think it's just nice to reinforce that we are all here for the same mission. We all want to keep children safe. And so we all have maybe a different way of doing it or different expertise, but when we can bring all of that expertise together, that's when we can really make the changes happen. So for those of you who don't know about us, because I was looking through the members that have joined or the attendees, and I recognize a lot of names, but there are a lot of names that I don't recognize. So if you've never heard of our program, we are a nonprofit 501c3, and our mission is to provide the education, the training, and the resources to make farm, ranch, and rural life safer and healthier for all children and their communities. And we do so through the Progressive Agriculture Safety Day program. It's now recognized as one of the largest rural safety and health educational programs here in North America, and have reached more than 1.8 million since we formed back in 1995. So real quickly, just to show you our footprint, where these safety days are taking place, all of those red dots that you see on this map from 2019 really shows you the 388 safety days that took place that year. The reason why I'm going back to 2019, as you guys are very well aware, 2020 and 2021, dealing with the COVID-19 pandemic, we had to really restructure what we were doing and have a lot of our programming move to virtual opportunities and online resources to still keep safety at the forefront during that time. But our in-person events weren't happening like they did back in 2019. So the good news is the COVID comeback is strong. So right now, I think I last looked this morning, and after only really having 50 safety days in 2020 and 187 in 2021, we have about 458 applications in for 2022. So, and we're making it a lot easier with online training to be able to provide that outreach all year long. So I'm very excited about that. And just so you know, annually we reach about 80,000 youth, like we did in 2019. We work with about 20,000 volunteers in these communities, and we do so because we have 400 to 500 trained safety day coordinators, like some of you that are joining us today, and that take the time to really be advocates and safety champions in their community. And this is really where our relationships are so important for this program that we've created with the National Children's Center. So I want to just highlight some of the ways that we've worked together in the past and the future here, where it's going. So we've mentioned a lot about CASN, the Childhood Agricultural Safety Network. As we've already heard so far today, the Progressive Agriculture Foundation was one of those founding organizations. So I'm very proud of the work that Susan Reynolds Porter, along with Dr. Barb Lee and Marilyn Adams did for being three amazing women in agriculture to really lead this effort and to see where it has gone now throughout the years. I am very honored to have been asked to be a member of the leadership team for CASN, and I think we have a great group here that are looking at even better ways to be able to reach folks with these important messages. There is also, as Marsha mentioned earlier, a new online community, which just makes for better collaboration throughout the year. And it's so wonderful that our foundation could be a part of that at the beginning, but now to see that there are over 100 other organizations that are involved, it just makes you smile. It really shows you how many people are invested in the safety and health of our youth. Another group I get to work with, Ag Injury News, which was mentioned. I served as a mention of the steering committee. This is such a great service that individuals, I'll just share an experience. Our coordinators sometimes they need to make a case for having a safety day. Maybe it's some teachers, maybe it's some communities think, incidents don't happen here. What are you talking about? We're in a safe area. No one gets hurt. The Ag Injury News database is wonderful because they can actually search and find incidents that occurred in their home state or community and really help make a case for selling why the program needs to happen. So I appreciate being part of that group, and I appreciate that being available for free at the fingertips of anyone who is interested. Our president and CEO is part of the National Children's Center Stakeholder Advisory Board, which I believe they just met recently. And, you know, it's a great way for them to hear from others about what should be happening, what could be happening to just make the Children's Center even better than it already is. We mentioned ISASH, and again, a shameless plug is just, if you haven't already, think about coming to our conference next month, because it's a great opportunity. This is great to meet everybody virtually, but it's a great opportunity to meet in person. I work very closely with a lot of the Children's Center staff through the PR committee. Melissa, who's on the call today, is a co-chair along with myself for that committee, but several of the Children's Center staff is part of that group. So we have Kyle, Brian, several others. I know I'll miss people if I start naming names, but they have served on that group and do a fantastic job. And then the leadership provided by the Children's Center to the organization itself. We have past presidents like Dr. Lee and Scott Heiberger, and also serving on the board now, Marsha. So it's a great opportunity to really connect, network, and work together on an important cause. And the annual in-person CASN meeting dinner, it is just, and I'll get to a little story about that here in a minute. That is a great opportunity that happens at ISASH. And just a great way to hear what's happening, get a pulse on what's happening from other organizations, other individuals working in the industry. So ISASH is a great way to bring us together. And I would say, I think the Children's Center might win the prize for having the most ISASH members. They got to be up there. I know there's a couple other centers that have quite a few, but it's always great representation. Then there's other ways through National FFA Convention. A lot of us are neighbors in a booth working in the ag safety and health area, part of the SAY and career safe area. So we get to all work together and collaborate on that each year. We have had some staff assist us with some professional development opportunities for our Safety Day coordinators. Scott recently helped with sharing some tips and tricks for taking quality, good photos at Safety Days. And he did a fantastic job. I think we called it Picture This, and it was a 1-hour lunch and learn. We got to record, and again, providing some great educational opportunities for our coordinators on a specific subject area that they may need to strengthen. We've also had countless other presentation and collaborative efforts over the years, from webinars and conferences to at farm shows. So the list goes on, and we're looking forward to many more to come. And then also finally, the Children's Center has provided us with some special project funding through mini grants, and allowed us to just make our mission even stronger and help us with some projects to keep, again, children safe. So my story, this is a picture from the CASN in-person meeting that was held during the ISASH conference back in 2014. It happened in Omaha, Nebraska. There you can see me. I have a little arrow because I'm kind of peeking out there. But this photo is very near and dear to me, because I was 2 months in, maybe even a little less, with the foundation. And this was my first real experience, my first in-person event. And I love this photo because of all the folks that I have had the opportunity to work with in the past, as well as still continue to work with. It's just such a great collaboration. And CASN has really helped open the door to that, or actually even just the Children's Center. And you know, Bernard Jeske, who's also pictured back here, if you can see on the screen, he's towards the back. He has been, he told me when I went to ISASH, my first conference, he said, you have to go to the CASN meeting. That is the who's who of child ag safety. So I had no idea what CASN even stood for at the time, because there's a lot of acronyms in the ag safety world. But boy, am I sure glad that I went. And I think about the years that followed and all the great collaborative efforts and the folks that I still get to work with today. So it's just very, very special, fond memory of me. And it's exciting to see 8 years where I got my start, and I can't wait to see everybody next month in Fort Collins. So just again, focusing on our relationship and some of the ways that the Children's Center has just been such a great resource for us is they really help us in answering our why. So they mentioned some of those statistics earlier, the ag injury and fatality statistics. And, that really helps drive home the reason that we offer our program, the reason that we do what we do. Because some folks might say, why are you doing this? Jana, why the Safety Day program? And when you can really back it up with those statistics and the research, and also what are the most common incidents that are occurring? How are these children getting injured? When you're able to back that up, that also just gives you a lot of credibility, and it also helps us in determining where to go from here. What new topic areas do we need to be focusing on? So we really, really appreciate that. As I already mentioned, we're partners in youth farm safety. So it really is where research meets outreach. We really are the outreach folks. We are going to the farm shows. We are going to the events. We're talking about this. But again, that research that the Children's Center has provided really, again, helps back up our program, really, really shows what we're doing is important. So we really, really appreciate that. It also goes into the resource sharing. So with our Safety Day coordinators that we train, we focus on a lot of the resources that the Children's Center has created, from the fact sheets to the youth ag worker guidelines to the ag media guidelines, which Scott was presenting about in one of those booster sessions we offered, to the safe play areas. Because our focus is our 4 to 13-year-olds and making it hands-on, age appropriate for those children. Sometimes the parents come to us. Maybe it's at a farm show, maybe it's after our Safety Day, and they want to know, okay, now what can we do? And a lot of times we'll point them in the direction of the resources created by the National Children's Center. And then last but certainly not least, they serve as connectors. So a good example here, we had a family, this young man, I believe 29 years old, was involved in a manure pit incident and passed away. His family wanted to do something about it. I believe it was Brian who connected him with our organization, and they were able to have a Progressive Agriculture Safety Day in his honor, in his memory, to prevent this from happening to others. So that's really just so important to us that we have connectors. We're all spread out in different parts of the country, and it's so nice that we're able to call on folks throughout the country to really help us with our mission. So I don't want to take up any more time. I want to leave this open for questions, but this definitely is a milestone worth celebrating. So congratulations on 25 years, and I'm excited for the next 25, and I'm excited to be part of it. So congratulations.
Wow. Thanks, Jana. That's you've got a lot of energy. And, it's great to hear all of those reflections of the past and the energy for the future. I don't know if we have any questions right now.
Nothing in the chat right now that I've seen,
Okay.
but I would certainly invite people to just unmute and speak up if you have questions, or if you want to share a memory or a thought or something, please speak up as well.
I can see Brad is back on here, so I know he's just waiting to say something.
Well, it doesn't take a lot of encouragement. You know me, I've got an extension background, and so yeah, I could talk endlessly, but I'm gonna try and keep it limited. First of all, congratulations on 25 years. It seems, actually, I would have thought it was longer than that. That's not much time for me these days. It's been great working with the center, and I remember being involved in one of the early planning groups to really put together an agenda for research and education on safety through the National Children's Center, and one of those advisory committees. Being on different ones over the years, I've always enjoyed that. It's this, you're just so well organized and so good at it. It makes it easy and enjoyable to participate. So, and the successes, you really have hit on the key factors, I think, in making a safer environment for youth on farms. One of the things I did want to mention quickly about, we all have a lot of the same connections. And I remember in the National Institute of Farm Safety, I think I was one of the first federal employees to ever become president. And Barb broke that glass ceiling as the first woman to become president of the National Institute of Farm Safety right after me. So we got to serve on the board together and other activities as well. Marilyn Adams actually came to DC shortly after I started in 1989, I think about 1990, 1991. And she, First Lady Barbara Bush, was her honorary chairperson for Farm Safety for Just Kids. And she was going to meet with her to plan an event in Iowa. And she invited me to go along. Back then it was easier to get approval for someone to do that. So I was able to go, and I enjoyed that. That was the first time I had been to the White House on official business, and the only time I went through the East Wing to enter the White House and plan with Barbara's staff. And that was a very memorable experience with Marilyn Adams. The other thing is just working with all these other organizations over the years. It's just been great. We contribute towards the extension side, but we also contribute toward the research side. And in recent years, as an engineer, I've always looked at how can we design the hazard out of the workplace. And I think technology is doing a lot of that. For years, I've been saying, well, someday tractors aren't going to have an operator's seat. So why would you put a kid on it to ride with their parents? And I think that can happen someday. We do have autonomous tractors. And I think there's multiple sides of that equation in the research, education, extension, and enforcement side. And I've always advocated the best enforcers are the parents or the first line supervisors. But just want to congratulate you on 25 years of fantastic work and being a chance to work with all your staff and go to all these meetings and planning conferences and be part of that. It's just been a wonderful experience for me.
Thanks, Brad. Thanks. It's been fun and really important to have you supporting this and being part of it all along. And any other questions or comments from folks? I see some messages are coming through. So I'm looking at the clock, and I think we'll just, Marsha, did you have some closing
I do have
statements?
one last slide I do want to share. So if you'll give me just a minute to bring it up here. I actually want to close with an invitation for everybody. We'd like to hear more from you, and we have several opportunities for you to join us. You can join us this fall. We're going to follow this up with an interactive discussion on what the future of child egg safety and health should look like. You heard Barb talk earlier about what some of the concerns are that are still out there. So later this fall, we're going to have a listening session type of virtual event where we want to hear from you. So we'll keep your ears peeled and your eyes peeled, and we'll have that coming up. Also, I encourage you to join the Childhood Agricultural Safety Network. You can learn more at cultivatesafety.org/CASN. You can email me or anybody in the center if you're interested in joining. And also, if you're interested, share your memories of working with NCCRAHS. We'd love to have those stories, any pictures, any videos, or anything else that you might happen to have. Just get a hold of one of us and we'll make arrangements on how to be able to get that information from you. So, and with that, thank you everybody for joining us today.
Okay. Yes, thank you all for celebrating our 25 years. It's really been fun hearing from so many of you and even preparing for this. And I just want to thank you all for all of the work you do to safeguard children in agriculture. It really takes all of us working together, and we have had many great accomplishments over the years. And I really want to thank my Marshfield staff, past, present, and the future. I think we keep getting stronger, and I've just been personally very, very fortunate to be surrounded by such great people here in Marshfield, Central Wisconsin. Who would have guessed, we could do it right here. So just thank you again for the people who presented. Thanks for those of you who joined us today. And yeah, have a great rest of the day. All right. Thank you,
Bye-bye,
everybody.
everybody. Thank you.